Good morning, everyone, and welcome. Welcome to the Massachusetts General Hospital Frontal Temporal Disorders Unit Community Forum Friday event. This week, we're talking about coping with care at home during the COVID-19 outbreaks. We're going to have tips and strategies for hiring and managing care at home, as well as some best practices for self-care and engagement. My name is Katie Brandt. I'm the Director of Caregiver Support Services and Public Relations for the MGH FTD unit. And I'm so excited to be here this morning with two wonderful community experts, Hector Montesino and Tammy Pozerycki. Welcome to you both. And I want to tell you a little bit about Hector and Tammy, and then we will launch into our program. So Hector Montesino is a 19-year professional. I'm definitely getting experts for you guys for our Community Forum Friday events. He's a 19-year professional in home care services and is the president of Embrace Home Care Services, an organization dedicated to working with clients and families to provide private duty home care services and management of care in the home. It is Newton Waltham based and in the Eastern Massachusetts area, providing assistance with all activities of daily living, such as bathing, dressing, meal preparation and med management, transportation, companionship, interaction, laundry, and all chores that can help to keep a person independent at home. Tammy Pozerycki. Hi, Tammy.
Hi.
Tammy has 24 years of experience working with people living with dementia and their families, caregivers, and healthcare professionals. Tammy is personally familiar with Alzheimer's as her maternal grandmother lived with the disease for years, and it was a firsthand experience on how this affected her family members. She holds a master's degree in counseling psychology, and Tammy is certified as an Alzheimer's disease and dementia care trainer, first responder dementia trainer, and dementia practitioner. She was the founder of Pleasant Trees Adult Day Services in Marlborough, Mass. It's a memory cafe and adult day program. She established the first memory cafe in Massachusetts in 2011, Create a Better Day Cafe. And Tammy is the founder of the specialized dementia training and consulting business, Alternatives in Alzheimer's Care. As a dementia specialist, Tammy continues to plant seeds for compassionate and competent care throughout New England and beyond. I mean, I think that we could see already that there's a wonderful brain trust here this morning. And I wanted to let you all know why we chose this topic for our Community Forum Friday event. So in working with many caregivers, I've been hearing from folks, two things that have brought this subject to our attention. The first is many of our families were utilizing the supports of adult day health services to help them navigate care and make it from day to day and week to week. Because of the COVID-19 outbreak, those adult day health programs are now closed. And for the first time ever, folks are thinking about how could I engage a home health service to help me care for my loved one at home. So that's what Hector will talk about. And then the other thing that we're hearing from folks is now that they're home all day with their loved one, how can they really keep them engaged? And Tammy will cover those parts. But I really like to start with Hector this morning. Hector, do you think that you could address some of the issues and questions that a family might have if they're using home care for the very first time?
Of course, it's actually right now with the sort of initial stages of this first group of people that have been affected by COVID-19, to see right now how families, how unprepared they have been for any sort of crisis that we have currently at this time. There are people that have home care and there are people that don't have home care. There are people that are, this disease is affecting people of all ages, and even people that have early onset or people that are late stages in dementia. So there's a whole gamut. It sort of changed the landscape of home care. Typically how a family approaches home care is usually there's a need. You might have a loved one that might have some cognitive impairment or sort of any sort of help or need that they have. And you will do some research. You will talk to your local hospital, your local council on aging. You can look online and sort of go through the process of going through the home care, sort of vetting companies and making sure that it's the right fit. But in these current times, we have to think about a rapid, quick response to how you approach home care. Usually what's happening, a couple of examples in the last few days, I've had couples, a 55-year-old man and his 45-year-old wife. He has early dementia and she has COVID and he has COVID, and they actually both live with her mother. And so, they're calling to see how, we can take care of the mother while they're both sick. So this kind of caught them by surprise. And usually to screen a home care company, you want to make sure that you figure out your needs. What are the things that you need to be done in the household? Most agencies in the private duty sector have 3 to 4 hour minimums per day that they provide services. I mean, blocks of time. So always have that as sort of something that the cost of care ranges usually in private duty in between $28 and $35 an hour. And there are agencies all over the state. And usually if you do a search on Google, Bing, whatever search engine you'd like, you will find there are a lot of companies around you. Then, the person can help with all the things that you mentioned before, with the personal care aspect, with meals, with med reminders. And in the time of COVID now, we have it that, there's sort of an extra layer of this that's on top. It's about keeping people isolated. And how do you keep people safe in their home environment? Whatever that is, it could be in assisted living. We're taking care of people in assisted living that have to be isolated from the rest of the population. So we are providing that care. And what precautions you need to have at home. In this specific time, we're finding that it's families that have to make sure that the caregivers feel comfortable coming into their home, because they are the ones that are infected, and the aides have to really be careful because our workforce is very limited in this type of work. So what I ask people right now is that now that the crisis has started, it's probably going to peak next month. We're talking 30 to 45 days from now. Today, start calling home care agencies in your area. It's private duty, it's expensive. If you quantify it with your monthly salary, but I think it's a necessary expense these days. There's no better investment than your health. And that to make sure that you're safe and that you can get through this whole, this is a very tough time in our lives. And, I would say to really get familiarized with it, because a lot of people that are in nursing homes or rehabilitation centers for rehabs, they might need to come home. And you don't want to be caught by surprise that you don't have the resources in place. So I would say start calling right now. Home care agencies, if you have somebody that you care for, or even if you're a young couple, or even if you have a parent in the home, or if your mom is in an assisted living and she might have some cognitive impairment, what if she falls ill and she needs to be isolated from the rest of the population and she needs care? You can't go and care for her because you have family and children. And so it's great for people to start getting ready now. The time to get ready has already passed, but you still have time to call around and get somebody to have a backup plan, because, and forget about for a quick moment about how much it costs, because the benefit that you will have from the help is significant compared to the nightmare that you'll have when you find yourself needing help and have no resources. So that's a big sort of part that I tell people to start getting ready, because we are going to see an uptick in infections and we need to be prepared. And, you know, if you're looking for home care, you can go to the Home Care Alliance of Massachusetts website. They're a nonprofit, and they have a whole list of agencies per town, per area. You also have Mass Home Care. Mass Home Care, it also has what we call access points. So if you're Mass Health or Medicaid, you know, you do have the opportunity to eventually apply for some sort of home care assistance that's covered by them. But right now, the backlog is so big that if you even went and signed up, you're not going to get the care. I have a family that got approved for 61 hours of home care, and they cannot get staff because they're so busy. And so you want to make sure that you go into the private duty market, you have an agency in your pocket, but that you've spoken to, that you give your information to, that you say, let me sign a contract with no commitment. In case if I need you, I can call you. Yeah. And so, and of course, search engines. You know, you can look at search engines, because some of you might live in rural areas, and rural areas have less sort of resources. So you want to really get that homework done. And you can still call the local hospitals and say, do you have a list of agencies? Your hospital and your doctors will have a list of providers that are local. No one will refer you or recommend you someone, but they'll have a list. And you want to get prepared, because you might need help isolating yourself from your family and still needing that assistance. And I will say too, that during these times, you want to make sure that if you're discharged from a hospital, a rehab, or wherever you are, that you have gloves, that you have protective equipment, that you have masks in your home. They are lacking. We are asking even some of our aides to improvise, you know, to do, you know, bandanas, or to do something to protect themselves, because we have a shortage of supplies. Gloves you can still get, you know, but masks and other protective gowns and the N95 masks are currently only for health providers and the government. So you really, and the masks won't completely protect you from it, but it makes people feel safer, and it does serve a purpose. So I think that, you know, people getting really informed and going out there right now and seeking that information and asking the right questions. And I'll leave a resource after this with a bunch of questions that you can ask, but really get on it immediately. I think it's sort of the best way to be prepared for the wave of sort of help that's going to be needed after this month.
You know, Hector, I really like how you're encouraging folks to be prepared ahead of time. And they might think, well, you know, we're both doing okay right now, and so we don't need home care because we don't have personal care needs or issues like that. One of the things that you told me about that your home care agency is able to provide is something as basic as grocery shopping for folks. And so I really love the idea of, you know, if you and your loved one are older and at home and you think, well, we're both doing fine, the idea of engaging with the home care agency, even to set up something as simple as grocery shopping, and then you have that contract in place. You've already given them all your info. So in case one of you or both of you were to get sick and you needed to ramp it up, it's really just a phone call, as opposed to filling out paperwork while you're sick and doing research to find a place while you're sick.
Exactly. And it's been sort of like that with an emergency. I'm working with a couple of hospitals that have called and said, are your aides open to working with COVID positive patients? And a lot of people say no, a lot of people say yes. You know, depending on your experience and how you know how to take precautions, you know, you might feel more comfortable with the space. But one of the things is that, you know, we have like a person that's right now 8 to 5 in our agency that's going around and doing errands for people, picking up their pharmacy, and the clients are just committing to a 3 to 4 hour period per week, but at least they have something in place.
Right.
And if they needed to increase that, they can, but they get their basic needs, because these stay at home, sort of orders, I think that they're going to get stricter and stricter as we go along. And so, you don't want to really risk, they're talking about that it might be that you can catch this even from somebody talking around you or breathing around you. I mean, they don't know, it's evolving.
Right.
Because of all the unknowns, yes, you're right. It's good to have a resource in place so you can actually, sort of call upon it when you need it.
And Hector, you may speak about your own program or home care in general, but let's say, for example, you were a couple living together and then the caregiver, and if we're thinking about a caregiver and a person living with dementia, what if the caregiver were to get sick and need to go to the hospital? Is our home care services able to provide even overnight care for individuals and loved ones?
Yes. The idea of having an agency is that an agency provides you with backup. So if the caregiver at home might not be able to stay with the loved one, a family caregiver or a friend caregiver, then you can call upon as a backup. But at the same time, if you have care in place and the person cannot make it, the agency can provide backup. So there's a lot of sort of resources that agencies can do. And it's very different from a visiting nurse. I want to sort of clarify that private duty is very different than a skilled nursing organization. So basically, a VNA comes in because you have a skilled need that you got out of rehab, you had surgery, many different things. Most people that are come, yeah. And so, but if you are home and you are declining, you can call your primary care physician and they could make a referral out to a visiting nurse. Telehealth right now is something that's really being utilized. An example, my own mother yesterday called me and said, somebody, she still works full time, God bless her, at 74. And she said, in my office in Florida, I got exposed to somebody that had COVID-19. And so she said, I'm very concerned. And I said, what are your symptoms? But I'm not a doctor. So she said, I'm going to make an appointment with my doctor. And I said, actually, no, call. And her doctor actually FaceTimed with her and spoke to her. And I think it is sort of the same thing even with home care. Right now, we're doing a lot of our intakes and a lot of the family conversations via FaceTime, via Zoom. To reassure families that if you need backup, if you're sick, if anything happens, that we're going to have the coverage that you need, because they are already with us. And we've taken the time to go through this. Very few agencies, without evaluating you, will start care right away. So that's why you want to start now. Even if you're not sick, you're healthy, you say, I'm a healthy 60-year-old, 50-year-old, but I want to have you in place in case if I get sick. These are my medications and these are my issues. Here you go. That sharing of information will be very important for your own self-care.
Absolutely. And I think what I'm really hearing from you is that while, of course, in our community of care, we're talking about often care for individuals living with dementia or progressive neurological disorders, but during this time of COVID, home care may be appropriate for individuals with normal cognition and who are healthy in many other ways.
Yes. And, we do have, I have clients that have frontal temporal dementia, and they have kept the care. The loved one is still working from home. They've kept the caregiver coming in 11 to 7 during the day, so that person can extricate themselves from the day-to-day care and provide and do their work full-time from home, and then have somebody take care of their loved ones. So, the idea of having that third person in your house or that fourth person in your house to be there to take care of is for you to take advantage for self-care. As a caregiver, you need a little bit of a break. Now with day programs being closed, with a lot of the ways that people were able to get some respite from caring for a loved one with dementia are gone, the senior centers, or just for younger folks, programming, memory cafes, day programs, you need respite. So the money or the investment that you were making to send a loved one to that, or even if it was sort of free, you still want to hire someone to come and give you some respite, because you're just going to really feel this feeling of being inside is leading to a lot of depression, leads to a lot more depressive states, for both the caregiver and the person that's there. But that person can take your loved one out for a walk, can kind of give you that moment that we all need, that we all need to be able to breathe and to think and to sort of not always keep processing home care 24/7. So,
And I know that Tammy will cover those issues as well. And so before we switch to Tammy, Hector, could you talk about some of the very specific, I guess, protocols that a family might want to consider during this time of COVID-19 that would be protective both for the individual receiving care and the individual providing care? So for
yes.
example, like arriving at the house, how might that look different during the time of COVID?
I think that we need to pull out our thermostats, our thermometer, sorry, and we need to pull out all of our cleaning equipment, Lysol, sprays, and make sure that there's soap and water ready for people. What we are doing with our caregivers and what we're recommending to families, I actually sent that as a resource and it'll be available after this. And it's really having a stop sign and your front door that says, before you come in, really checking about your symptoms, taking your temperature, washing your hands, and then wearing your protective equipment before you enter the person's home. It's important the same way as if you're going anywhere, you want to make sure that you have your protective gear. The home right now is our sanctuary. So whenever somebody's coming in, the person needs to be healthy, but really taking those protocols to make sure you're washing your hands after every chore. I mean, all the things that the CDC has actually talked about, but more adapted to your home. Every home is different. So you really want to look at what are the risks of the person that you're taking care of, and then utilize the regular protocols and adapt them to your loved one. Nobody can walk into assisted livings anymore without a mask and gloves and washing their hands. I mean, I went to BJ's a few days ago and they actually have a sink and soap and water and Purell right at the entrance. So, so it really is important that when people enter the home or wherever the patient lives, that you actually have, your people take their temperature and, as I said, wash their hands, wear protective equipment. And really that is for everyone, family, loved ones, anyone that's the word caregiver when you're caring for someone. It's very important.
I think that's really important. And so I love the resources that you gave. I've been putting them in the chat and they will be available. We'll put them in the description when we post this on YouTube as well. And I think one resource, Hector, that we haven't talked about, but is the Alzheimer's Association.
Yes.
To know that they have a 24/7 hotline and that individuals can call and ask about home care and get a list, correct?
Yes, and actually they still have their hotline available. Mm-hmm. Remember, if you're actually going through a tough time, the Alzheimer's Association is your ultimate resource. You can actually call them. Their social workers and their case management team is still available. Everyone's working remotely. The world hasn't really stopped. So reaching out for support, the Alzheimer's Association is the best resource that you can do right now for your help.
Hector, that's really great. I'm glad that you'll also stay with us now, but I'd love to turn it over to Tammy. So, Tammy, as Hector's talking about the ways that we can bring someone into the home to provide help with care, One of the things that really strikes me for folks who this is their first time is even thinking about what is that like to integrate having a helper help you when you're providing care for your loved one, and how does that play into the idea of engagement at home?
So, what I've experienced way before COVID is that caregivers, spousal caregivers, children, partners, they feel that they are the ones that should be doing the care. They feel that they are committed, that they are the ones that can give the best care and that know the person the best. And that is all true. In terms of when I used to run a day program, it was very difficult for that person to let go. I compare it often to when you if and when you ever brought a child to child daycare and that child was gripping the legs of the parent, crying, didn't want to let go, the parent leaves crying, and it's that separation anxiety. And there's a lot to be said about doing it sooner rather than later, especially with someone living with dementia, because the separation anxiety is only going to get worse as the caregiver and the person living with dementia are stuck together in the home. Breaking that again is going to be even more difficult. So it's the individual caregiver that has to really work on themselves and get the support, get the counseling, get anything they need in order to let go. That might mean that things aren't going to get cleaned as well. Things aren't going to look in their place as well. Frustration grows. One thing I want to point out is with people living with dementia, they are magnets to our emotions. And it is so important that we keep our emotions in check. Now, I myself, my anxieties, my worry, even depressed moments have just grown immensely. And so people who have had mental health problems or challenges prior to this only magnifies it. And Hector mentioned the depression. So things that we can do: turn the TV off, turn that news off. I am limiting my access to the news because there's nothing good to share. With people who are living with dementia, that news and that television become their reality. And if I'm caregiving for a loved one with dementia at home and I'm seeing and absorbing all this scary news, it's just going to flow into that person. So there's so many things that we can turn the negative to positive. And the old adage with the airplane: you're on the airplane and the oxygen mask comes down. It's the person that has to put it on themselves first before they put it on their loved one. So we have to walk the walk and talk the talk in order to successfully care for ourselves and care for the other person.
I really liked what you were saying about, turning off the overstimulating or negative things on TV, but also having an awareness that many adults, TV is part of their daily routine, and even they like the idea of learning from TV. So, do you have recommendations for programming or ways to use TV that could even be therapeutic?
Absolutely. I'm doing this when we're taking care of my granddaughter. They have virtual museum tours, they have education programs, Planet Earth, Blue Planet, National Geographic Channel. Um, it's so important that we get the support from education. Like if they, because that habitual turn on the CBS News every night has to change in order for the person to benefit from calming activities. There's concerts, there's virtual concerts online now. They're doing a big country music thing where all the artists are going to perform on Sunday night. You have to do your homework. A couple of things. There's a website called eldersong.com that provides caregivers with a repertoire of things that they can go to, books that have trivia and reminiscing, and DVDs and music sing-alongs and things like that. activityconnection.com, that you do have to have a membership too, but you may want to, in fact, check with a day program that you belong to or a facility that your loved one is in. They can then give you the tools from activity. There's a password that'll get you in. And when I ran the day program, I gave it to all my families and my staff because they have something for like a daily chronicle. And you can print that off and share daily current events and daily days in history. I mean, you open up a newspaper and those are still negative. Even the day in history is negative. So it's really focusing on how to, as I named the Memory Cafe, create a better day. And you can create a better day by focusing in on the positive activities and engagement. Lots of times, the caregiver, the home caregiver, just lacks the capacity to know what to do. What do I do with my loved one all day? And sitting in the recliner chair and having the TV on is not what we want to be doing. We want to focus on what that person's interests are, their abilities, their talents, and build off of that to engage them in cognitive, intellectual, stimulating activity, physical activity. Hector mentioned, having a caregiver take them out for a walk. Getting them out is important. Keeping structure and routine. The wonderful thing about day programs is that they keep that person on structure and routine daily, and they depend on that. That's something they can look forward to. So a caregiver from home care comes in, they can keep them on structure, routine, and engage them. That's very important to point out when you're seeking out a caregiver for respite, is that they are educated and knowledgeable about how they're going to come in and engage that person. There's a golden rule that I'd like people to follow. That golden rule is, if your loved one says, "Can I help you with that?" the answer is always yes. You want to provide them with the opportunity to feel useful, give them household chores to do, and also compliment them. If they're, it's turning that negative into positive. So yes, they may have not dried the pot enough to put it away. Thank you so much for your help. I really appreciate it. Positivity, that's what we need to instill in folks. And really, the one thing I do want to point out too is that sundowning period. If people haven't heard of what that is, that's the later in the day. It's when the sun goes down. Those folks are more fatigued. They've been up all day. They get more confused. That's when we see the symptoms of dementia enhanced. That's the time of day when we're going to need to really focus on the person, get the respite, have engagement, music activity, give them a job, because during that time frame, a lot of folks are exit seeking. They want to wander. They want to leave their home. This time of day is particularly difficult. One thing we can do to help during that time is we want to offer the person living with dementia a quiet time during the day, preferably in the afternoon, giving them a chance to rest their eyes, rest their body, and not putting them to bed for a nap. We do not want to encourage sleep in bed or REM sleep. We want to encourage about 30 minutes, 40 minutes in a reclining chair, a couch, putting on soothing music, and let them have their quiet time. And this can help rejuvenate them for the rest of their day and decrease sundowning symptoms. We can also shut the shades, turn the lights up, and make the inside look more like daylight. That often will help with symptoms as well.
Tammy, I really thought that was such a helpful tip when you talked to me about that and the importance of sleep at night is in bed, and that promotes the REM sleep and cueing our loved ones that we're going to be sleeping for a long time now, but that when we want our loved ones to have that period of rest, encouraging them to be in a comfortable chair or a couch, and how that can promote good quality sleep at night while giving them a little boost of energy for the rest of the day. I thought that was really a good tip.
It's good for their health too, and because with dementia, the circadian rhythm wants to reverse, and unfortunately, what we see with family at home is that they contribute to that. Because they're just allowing they don't know what to do with them, and they get bored, and with boredom, we see enhanced behavioral symptoms. It's often I tell folks, look, all these parents at home creating a structured day for their children. They've got to do online learning. They've got to do some physical activity. They've got to eat their lunch. So all these things need to be done for the person living with dementia to structure their day, get them energized, get them stimulated, fun activities, cognitive, physical engagement, socially connecting with family. And if it's at all possible to get family and friends on a Zoom platform or on a FaceTime call, super important to keep those connections, not only for the person living with dementia, but also the care partner as well.
Absolutely. And I think it was also really important. You're talking about exercise and physical movement, but what if it's a rainy day, or what if you are worried because your loved one is not a steady walker? So you might not feel safe going for a walk together. What are some of your ideas for folks around being physical if you're in the house?
It's really simple. It really is. Do chair exercises. Have the person in a chair, turn on some music and do simple movements. YouTube has a plethora of exercises for older adults, chair exercises, music, dance, yoga, meditation. You can go on ElderSong and buy, if you have a DVD player, get some DVDs as backup. I myself struggle on these days, these rainy, dreary days where you can't get out, because in all honesty, getting out for a nice walk is what enhances our mood.
Mhm.
But you can't just use that as an excuse to laze around all day. You have to keep up with the structure and routine, because that exercise piece spikes the endorphins and really can have an effect on our mood. The other thing is a healthy diet. Too much sugar, caffeine, all those things can affect our mood, affect our sleep, affect our energy. But physically, you can do a body scan with them, close your eyes and focus on your fingers, and just simple things to keep people moving and engaged. They have exercise bands. You can get a balloon, a simple balloon or a ball, and toss it back and forth, or create games, physical games, like you take a laundry basket and you take different objects. One thing I saw was you empty your cabinet of all your Tupperware and all your Tupperware lids, and you sort it all out. You just throw them in a big laundry basket, and it's the person's job to help you find all the matching covers so that you can neatly put them away.
Yeah.
It's like folding towels in laundry, bringing it up from the dryer and having them help do that. Fold napkins. The bookshelf. We have to dust the bookshelf. Could you help me take all the books off shelf, dust the shelf, put them back in a nice, neat order? And of course, whatever order is fine. So there's just Alzheimer's Association actually has 101 ideas to do with the person living with dementia, that you can download those ideas. Sorting's a wonderful, very relieving activity for a person. Sorting coins, sorting buttons, socks, anything you can think of to get them engaged. Remember household activity. These people had responsibilities in the management of a home. And if you're stuck at home, there's plenty to do. You just got to think outside the box sometimes.
And then I'm hoping that both of you could kind of comment on this, the idea that how do we help our loved ones that may have cognitive impairment understand that something is a little different, right? Like, it seems like you're here all the time now. And sometimes my friend from the home care agency comes and you used to leave when they came, but now you're here. Tammy, could you start by talking about how can we help to comfort our loved ones with dementia or cognitive impairment if they're sensing that things are a little bit off?
You know, I've always taught people to go where the person is at. So what does that mean? That means that, you know, there's something called a fiblet that we use. And a fiblet is really what we call a therapeutic non-truth. We don't want to understand it as a lie because that's negative. But fibleting with a person is oftentimes a way to reassure them. Now, anytime the person sees change, it's going to spark that curiosity and that concern. I always ask folks to validate that person's feelings. So if they express concern, we want to validate that concern by saying, I hear that you're feeling this way. And you know what? The empathy comes next. I can imagine how you must feel because this is really different, isn't it? But let's look at the positive side of things. We get to spend more time together. We get to be creative and do things that when I was going to work, I was unable to do with you. So trying to validate, empathize, might have to throw a fiblet in there, because fibleting is reassurance, but we want that fiblet to be believable to that person without scaring them. Now, if that person has been open to the news, they know about the COVID, they know about all these deaths and all the trauma, guess what? We have to validate those feelings. We have to empathize with those feelings. But then our job is to spin it around. We call that redirect. Spin it around to the positive. So even though they're expressing the negative, you've got to validate and empathize, but then spin it to a positive. And that's your cue. When they start to verbalize the anxieties and the fear, turn off the television. Let's stop talking about the COVID-19 and making that person have the absorption of that. So I don't know if Hector has anything to add to that.
I really like the three things that sounds like Tammy was saying, right? Validate feelings, empathize with feelings, and redirect in a positive way. Hector, what do you think about those things?
Well, I'm an alum of Alternatives in Alzheimer's Care, so I'm a Tammy alum, and the fiblet was really my favorite word because, you know, it really is sort of meeting them where they are. A recommendation for when you bring staff in and for caregivers to really kind of, if it's somebody who's new and doesn't know your parent or your loved one or your husband or your wife, to really sort of let them know what is the conversation, where they are at. So that way the person can kind of continue that same string, meaning, okay, mom used to go to the senior center, or my husband used to go to the day program every day, and they constantly keep asking, why is it closed? Is everyone okay? And what we're saying is that, you know what, they're under remodel, or you know what, because of this, they're not open, but everyone's doing okay. It's great to let the caregivers know, so that way the caregivers can be reassuring. So we don't say, I don't know, because I don't know creates a lot of anxiety. You have to have an answer. For a person with dementia, you have to have some sort of answer that is reassuring. So what I would say is that we're all on the same conversation, we're all on the same page. We all have, and that's what I would recommend for anybody that has a caregiver, to keep the caregiver informed, to say, hey, look, this is what mom or dad or husband asked this morning. This is what the response was, and we keep that same conversation going, so it's reassuring. So they're not, they're absorbing, as Tammy said, they're like a sponge. They're absorbing all the angst that's going on. And so to keep that story straight and to keep the conversation like sort of going in a positive way, you need to make sure that everybody's on the same page.
Can I say one more thing, Katie? And I meant to mention this before. A lot of these folks who were going to adult day health, they were receiving care as far as their ADLs, their bathing, their grooming, their dressing, their showers, maybe toileting. I am a big proponent of having an educated personal care attendant come and provide that continuum of care to them. And the reason is because I truly feel that when a loved one, whether it be a spouse, a child, a partner, when their caregiving turns to providing ADL care, it changes the dynamics of the relationship. I'm not sure of any older adult out there that would like their child bathing them, number one. And number two, for a spouse, they have to, or a partner, they have to remain a lover, a friend, a companion, an advocate, and allow the professional person to come in and provide that care, so that it's again respite, taking care of yourself, and not sort of stepping and crossing the line to private care.
I think, Tammy, you're helping us end on the note that I was hoping we'd end on. I was hoping that you and Hector would each say, if there was one message you would like to give to family members or caregivers about a self-care practice as we wrap up today. Tammy, is there something that that you coach caregivers to think about when they're thinking about their own self-care during?
Yes, I want to impress upon you that it is so important to get support. You can't do this by yourself, whether it's individual psychotherapy, as Hector said, telehealth, and Skyping calls, and also support groups. And I know they have some virtual support groups as well as virtual memory cafes happening now. Sleep is very important. Exercise, diet, and checking in on your own mood, and getting the help that you need, and maybe some pharmacological intervention if you need it.
Mm-hmm.
Right. And so for support groups, again, we would remind people to call the Alzheimer's Association 24/7 hotline and find out what support groups have they converted to virtual. And then folks who are dementia caregivers are always welcome to join the virtual support groups that the MGH FTD unit is offering every Tuesday during this time of COVID. And we're alternating a morning and an evening time each week. And so, Hector, if you're thinking of your message of self-care and respite, what is it that you would like to tell our community of caregivers today?
I would say be open to the idea of this Zoom virtual help. I know that we are used to touch, we're used to being person to person, one-on-one, but we also need to practice that self-care that Tammy spoke about. Meditating, literally closing your eyes for 10 minutes or 5 minutes and feeling the bottom of your feet, feeling your calves, feeling your body, feeling your hands, and really sort of kind of getting in touch with yourself. But at the same time, you have to reach out for help. That is the one thing we can, it's very taxing to try to do it alone. And as Tammy said, we can't do it all. And I think that, you know, opening your mind and getting information, you know, the best medicine is knowing, is information. When you know something, when you are secure about something, when you have that security, you feel good. So if you have care and resources, Alzheimer's Association resources, the FDD unit resources, you're going to feel much more comfortable and not alone. And that's the idea. Do not isolate yourself. Reach out, get on the online community, and look out for resources.
And I would just like to say that it is truly an act of love for your loved one when you're taking care of yourself, because you're the first person who's going to provide care, set up care, and advocate for your loved one. And so you really need gas in your tank if you're going to be able to do those things. Hector and Tammy, you both have brought expertise, but also just warmth and compassion. I thank you both for giving time to us today during this extraordinarily busy time in your personal and professional lives. And thank you for the gifts that you're bringing to our community. I truly appreciate it. And
Thank you, Katie. It's
Thank
been
you,
a
Katie.
pleasure.
It's been a pleasure. Thank you.
So the recording from this session will be posted on our MGH FTD unit YouTube channel, and I will include the resources that we discussed in the description below. I hope that everyone stays safe and well, and we'll see you at the next Community Forum Friday. Bye.
Bye.
Bye.